Hello, my name is Tracy Jensen. I'm a public health major at the University of North Carolina, Greensboro. This is my presentation on the health disparity of cervical cancer in American Vietnamese women. What is the etiology of cervical cancer? Cervical cancer is an uncontrollable growth of cells in the cervix of a female's reproductive organs. According to the Center for Disease Control, cervical cancer is the easiest gynecological cancer to prevent with regular screening tests and follow-up. It is also highly curable when found and treated early. The pap smear screening is the regular screening test used to detect cervical cancer. The Healthy People 2020 goal for pap smear screening in females in America is 93%. Unfortunately, American Vietnamese females are only hitting this goal at 79%. This leads me to the discussion of what is this health disparity. Cancer is diagnosed in American Vietnamese women at a higher rate in comparison to other Asian ethnicities and non-Hispanic whites in America. According to the National Center for Reducing Asian American Cancer Health Disparities, Asian Americans are the first racial ethnic minority group to have cancer as a leading cause of death. This is very disconcerting considering the American Vietnamese women are not just women and men are the fastest growing ethnic minority group in America. This is significant for public health as that increases mortality and morbidity for cervical cancer across the United States. What is causing this health disparity? The research has shown between all theories that the low cervical cancer screening is increasing the occurrence of cervical cancer within this demographic. I focused on two determinants: the socio-ecological perspective and the cultural beliefs within the Vietnamese culture. The sociological perspective underlines the interaction of various factors of behaviors of American Vietnamese women and low pap smear screening. According to the research, it was determined that an individual's characteristics of age, pregnancy, marriage status, and patient-provider relationship all affected the individual's choice to seek preventative screening. For a majority of American Vietnamese females, pregnancy was their first interaction with a healthcare provider in pap smear screening. This indicates that the relationship development between a healthcare provider and a patient allows for effective communication on education and prevention of the screening of cervical cancer. This relationship is also important for future screening for the patients. Moving on to culture, the Vietnamese culture is fundamentally conservative, and due to personal beliefs, Vietnamese women do not view themselves at risk for cervical cancer. Deep-seated beliefs that one is not sexually active until marriage, and personal efforts in cleanliness aid in prevention versus screening. Continuing on with mothers as the primary source of health advice propagates this health disparity. So what can we do? What interventions can we put in place or should we suggest to help with disseminate this health disparity among American Vietnamese women? If education and access to pap smear screening can be combined with cultural sensitivity, improving the relationship with healthcare providers, then this disparity gap could be decreased in the future. Without relying only on the healthcare provider's relationship, disseminating information and education in churches and community gatherings offers a safe place for this and for the benefits of a pap smear screening to be understood. Not to forget that the community workers can also work with the older American Vietnamese generations to change the ideas of what is important and how cervical cancer is contracted and how we can prevent such a cancer that can be easily detected and taken care and prevented. All this can be in collaboration with healthcare providers, offering a team to help this health disparity from continuing on in American Vietnamese females. I appreciate your time. I hope you enjoyed my presentation on cervical cancer in American Vietnamese females. Thank you.